Welcome to the UTMB Texas Transplant Center's Social Work and Dietitian video. The Texas Transplant Center offers excellence in patient care. We have a dedicated team of transplant social workers and dietitians who will assist you along the way during each phase of transplantation. The video provides a short introduction to the information shared with you by your social workers and dietitians. Before the transplant, the social worker will meet with you to talk about your support system, insurance, financial situation, coping skills, compliance and adherence, educational resources, and will address any problems or needs that you may have. The social worker will also talk to you about the medications you will need for the survival of your kidney. It is your responsibility to pay for the medications, including copays. Medicare Part B may pay for some of your immunosuppressants. It is important to save at least $2,000 for the first month of expenses, mainly for medications. For example, Valsite, a medication you may need to take, is covered by Medicare Part D, but the copay can be very high. If you receive American Kidney Foundation grants, they will stop paying for your premiums after the transplant. Medicare Parts A, B, and D will stop 3 years after transplant. It is crucial to develop a plan in preparation for this. Your insurance will be verified before you're put on the transplant list. Remember to talk to your dialysis social worker if you do not have kidney health care. Kidney health care can help with transportation and medication copays after the transplant. The social worker will talk to you about organizations and fundraising that can help you lighten the financial burden of the kidney transplantation. National agencies can provide guidance or sponsor your fundraising efforts. Here's the list of resources. Communicating with your donor's family is an option. However, donors are usually anonymous. If you know your donor's family and wish to write them a letter, you can contact your post-transplant coordinator to organize it. You cannot identify yourself in the letter to your donor's family. Some other patient responsibilities include campus parking and housing. Some hotels may offer a discount to UTMB patients. Remember to have an advance directive and power of attorney. It is important that you choose someone you trust to carry out your wishes regarding your medical treatment if you are unable to make decisions on your own behalf. If you need to speak with a social worker, please call 800-323-4109. The dietitian will do a complete nutritional assessment for you during the pre-transplant evaluation. It will include diet history, medications and food allergies, factors affecting nutrition, and a physical assessment. Physical assessment determines body mass index by measuring height and weight. The assessment will also determine weight distribution by measuring waist and hip ratio, muscle, and belly fat. As mentioned before, the body mass index is the relationship of height and weight. It helps figure out how much you should weigh. An underweight BMI is less than 18.5. A normal BMI is 18.5 to 24.9. An overweight BMI is between 25 and 29.9, and an obese BMI is 30 or greater. In general, the guideline for a kidney transplant is a BMI below 38. However, the transplant team prefers it to be less than 30. If you are receiving a kidney from a living donor, your BMI should be less than 30. Being overweight, obese, or severely underweight can cause and affect many conditions and/or diseases before and after transplant. Abdominal obesity or belly fat could interfere with the transplant. There are many conditions of being overweight or obese, such as stroke, cardiovascular disease, high blood pressure, diabetes, high cholesterol, chronic kidney disease, arthritis, gout, degenerative joint disease, some cancers, sleep apnea, and fatty liver disease. There could be complications due to weight issues such as slow organ or poor organ function, short organ survival, poor surgical healing, bleeding, infection, longer hospital stays, and rejection. What leads to being overweight or obese? Some medications, eating more than you need, not being physically active enough, and absorbing excess calories from peritoneal dialysis solution. What leads to being underweight? Some medications, eating less than you need, some medical conditions, and genetics. If you are not a healthy weight during the transplant workup, you can work with your doctor and dietitian to make a food and exercise plan. The most important aspect of your health after the transplant surgery is hydration. Increase your water intake to 8 16-ounce water bottles per day. In addition, you may need to watch your potassium and phosphorus intake for a short period of time after the transplant. This is extremely important for the life of your new organ. We look forward to working with you. Thank you from all of us at UTMB.